Hello there, and welcome to Health Matters, a presentation by the Ministry of Health, and we are glad that you can be with us. On our program today, we'll be discussing quite an interesting topic: blood pressure. And the stats is out there. Many people, Guyanese and those living outside of Guyana, do have blood pressure, high blood pressure. With me on our program today, we've got Dr. Mahendra Carpen, head of the medical services and cardiology of the Georgetown Hospital there here in Georgetown. Dr. Carpen, welcome to our program.
Thank you very much for having me here today.
Blood pressure, basically, what is blood pressure?
Yeah. Well, thanks for bringing this topic to attention. It's a very important topic. It affects a lot of our Guyanese people, and just as it has affected people around the world. If you imagine water flowing through a pipe, for the water to get from the pump to the pipe in the kitchen, there's a certain amount of pressure that needs to be generated to take that water from the pump to the pipe. Now, there's a normal amount and then there's an abnormal amount. Too little or too much is not good. Now, blood pressure is kind of similar. It is that pressure that is created when the heart pumps and it sends blood through the arteries to the various organs of the body, from head to toe or brain to the peripheral tissues. And it's a function of the strength of the heart muscle to pump, but also the tone of the blood vessel, or which could be likened to the pipe. And that tone is very important, very critical, because it regulates the amount of blood flow to the end organ or the tissues that you're trying to perfuse or send blood to. And blood is very important because it takes oxygen, and that allows the tissue to remain alive and to conduct its metabolic or functions of living, so to speak. Mm-hmm. So blood pressure essentially is something that is a key and critical element to survival.
So what would be a normal blood pressure that one should have so they don't have to see you, a doctor?
Well, blood pressure, the definition of high blood pressure essentially has changed over the years, but essentially there are two numbers to blood pressure, a top number or a bottom number. Mm-hmm. The top number is called systolic and the bottom number is called diastolic. The top number has a range. It can go from 90 to 139, or let's say 140. And that will be considered within normal range for top or systolic. And the bottom can go up to 89, 90. When it gets to 90, we say that's borderline high blood pressure. So you can go from like 60 to 89 and still be within the normal range. Depending on the type of person or patient, you can allow flexibility at a bit lower range. High blood pressure is the real problem because it has often been referred to as the silent killer because people don't know that they have high blood pressure. Low blood pressure, on the other hand, a lot of my patients will come and say, "Doc, my pressure is low." But we don't define low blood pressure by number. We define it by effect. So blood pressure is low when it has symptoms accompanying it, not because you test it and it's like 90 over 50 or 55, because that could very well be the tolerable level of blood pressure for that particular individual or that patient.
Mm-hmm. So what causes the pressure to fluctuate in, let's say, the average age person, especially in the higher range?
Yeah. So there's normal physiologic or movement of blood pressure during the day, during the night. During the day, as you're awake and you have to encounter all of life's challenges. In Guyana, as you drive on the road and somebody try run you off, or you in traffic, heat, air conditioning not working, whatever. You go to job, you're stressed out at your work, blood pressure will fluctuate up and down. And when you go to sleep at night, it is supposed to drop. So there's a normal daytime, nighttime variation in persons. When it becomes abnormally high, it's not just the individual high reading, but when there's sustained high blood pressure. So a number of readings done during the day average out to be above what you consider the accepted normal range. Now, the vast majority of persons with high blood pressure, there is really no identifiable cause. But in a minority, there are some what we call secondary hypertension, where you know the cause, and if you treat the cause, you can alleviate the hypertension.
We'll come back to those secondary causes. We'll take a break, and when we come back, we will continue our discussion about hypertension with Dr. Mahendra Carpen. Don't go away.
Hypertension, commonly known as high blood pressure, is when the pressure in your blood vessels is too high. It is common, but can be serious if left untreated. People with high blood pressure may not feel symptoms. The only way to know is to check your blood pressure. Consistent blood pressure readings at 130/80 mmHg are considered high hypertension. The first number represents pressure during heartbeats, while the second represents pressure when the heart rests. Risk factors like certain health conditions, lifestyle, age, ethnicity, and family history can increase your chances of developing high blood pressure. By lowering your blood pressure with exercise, a healthy diet, reducing stress, not smoking, and limiting alcohol and sodium intake, one can delay the progression of high blood pressure. For those persons already living with the condition, it is important that you take your medication as prescribed by your doctor. If you feel unwell, have high numbers, or want to learn more about hypertension, visit your nearest health center, and always remember to check your numbers. A message from the Ministry of Health.
Welcome back to our program. Glad that you're still with us. Quite an interesting discussion here on hypertension. Doctor, we were talking about the secondary causes.
Yeah, so a long time ago when I was in medical school, we talked about the secondary causes of hypertension following the acronym REDCap. R means renal or kidney. E is endocrine, people with thyroid problem, other endocrine issue. D is drugs. Certain drugs are known to cause hypertension, cocaine and alcohol as well. C, A, coarctation of the aorta, and P, pregnancy. Hypertension in pregnancy is a significant issue, and it can lead to very bad outcomes for mother and child. So there are a few others that you could stick in there, but if I was to examine my medical students and they followed that, I would be very pleased to say these are the secondary causes of hypertension. The vast majority of persons who are hypertensive, however, they have what we call essential hypertension. We don't know the cause, and oftentimes, even though we will do some investigation to see if there's a secondary cause, we will not find it. The younger patients, we have to go looking for secondary causes of hypertension, and particularly female within the reproductive age group. We have to look for secondary causes of hypertension. Now, once you pass the 45, 50 age group, we generally assume it's essential hypertension, where you can search for the cause, but oftentimes it's a futile search. So at that point, the challenge is now to minimize the long-term effects of hypertension, which is, there are numerous. We can talk about the effects of hypertension from head to toe. Mm-hmm. But essentially, we use a lifestyle modification as well as medical intervention to reduce blood pressure to acceptable normal levels.
Let's talk about those lifestyle, because one of the common reasons you hear, you consume a lot of salt. Yeah. Tell us about the lifestyle.
Yeah, so lifestyle essentially means adjusting to healthy habits. Mm-hmm. And diet, exercise. Diet includes reduction of salt. It's a very difficult thing to eliminate salt from the diet. Everything you eat, once it's processed, part of the production system is to put salt in it. That's what gives it a lot of taste that mankind has become accustomed to. So but you'll minimize salt instead of adding, excess salt. You'll want to perhaps just a sprinkling or even no salt added to food. And a lot of patients are able to adjust their lifestyle to accommodate that. So salt is a huge component of lifestyle change in hypertension. Alcohol consumption as well. Alcohol can cause initially vasodilations or lowering of the blood pressure, but a chronic use of alcohol can cause hypertension. Then other things for lifestyle changes include exercise. Routine exercise, 30 minutes a day, 5 days a week, of just walking, swimming, running, cycling, regular things. You don't have to be in a gym trying to buff up and do all of those, advanced level of exercise, but just walking 30 minutes a day or 150 minutes per week. The American Heart Association recommends that is sufficient to maintain a healthy lifestyle with exercise. Just do sufficient to break a sweat. You don't have to be training for marathons, etc. So diet has its role to play in prevention and management of hypertension, lifestyle changes, and of course, smoking is a big one that we do not at all encourage. If you're not smoking, then don't start. And if you are smoking, cut down to the point of where you're going to eventually get to zero cigarette consumption. Now, it's not an easy thing to cut from a pack a day to zero right away. And oftentimes patients need professional help to get to that point. But it's a journey that is worth traveling.
What about the medical issues that can trigger high blood pressure?
Yeah, there are, medical concerns, particularly endocrine issues that can cause hypertension, which is why we'll do a battery of blood tests to find whatever is abnormal and then address it there. One of the things that is under-recognized in particular patients of African descent is the imbalance within certain hormones that can cause this disequilibrium in their electrolytes, which is sodium and potassium. And that's a key in where, recognizing that early, because there's a specific type of treatment that would work for those patients.
So before we continue, let's look at the flip side. Low blood pressure.
Yeah.
If you have it very low, what can cause that? What can some effects?
Yeah, there are a number of things that can cause low blood pressure. But as I said before, low blood pressure is not really such an issue unless it causes symptoms. And what are these symptoms? Tiredness, easy fatigability, dizziness, feeling like you want to pass out if you stand up too suddenly, or we can call it vertigo. Those kinds of things are more important for low blood pressure diagnosis rather than the actual number that you get when you check the blood pressure. So alcohol in its early stages can cause that. Persons who are dehydrated can have low blood pressure. Certain medications can take the blood pressure too low. And those are things that we would screen patients for if they come with such complaints.
So walk us through. So I've gone to the doctor, they give me those high numbers.
Yeah.
What now will the doctor say to me, and what will most likely happen?
Yeah, so doctors should recommend and counsel patients on their appropriate lifestyle changes, which we talked about, the diet, the exercise, the habit-changing behaviors. And oftentimes, the initiation of medications will follow. Now, there's some medications you can start, but you have to monitor patients' kidney functions and liver functions, etc. Currently, the Ministry of Health is embarking on what we call a STEPS approach to hypertension. And this is a very well thought out, organized program to help control blood pressure, where it includes not just medical intervention, but lifestyle, counseling patients, monitoring them, etc. And we have a program called the HEARTS program that we are encouraging specific medications to be used in patients, ensuring that these will be available to all patients, not just those in the private sector, but also in the public sector at the health centers, the tertiary hospitals, the secondary hospitals. It's an aggressive drive to bring the issue of blood hypertension under control in the country because of the effect it has on the individual, the community, as well as the country in the long term if we do not control it at this level.
Some people say almost all medication comes with side effects, or some of these medication that even the GPHC or the Ministry of Health uses, or other medication, do they come with side effects?
It's a known fact. All medications have side effects. And so there are several strategies to mitigate these. Of course, there's the odd patient that will react to even the smallest doses. So we do have a strategy of starting small and incrementally increasing medication. We generally try to use multiple medications at small doses rather than one medication at high dose, because at higher doses you will have the side effects. So even though medications have side effects, when you look at the risk-benefit ratio, the benefits far outweigh the risks.
And then you have people who are on multiple medication, taking medication for other health issues, and now that can also cause, other side effects.
Yeah, a very significant number of our patients don't like taking medications, and they always worry about cross-interaction with medications, etc. Thankfully, the classes of medication that we use for hypertension generally do not cross-react with each other. And even there's a clustering of chronic diseases in these patients: hypertension, diabetes, abnormal cholesterol, etc. The medications that are used to treat each individual of those chronic diseases, they do not generally interact with each other. They might all be processed by the liver or eliminated by the kidneys, etc. But overall, the science has evolved in such a way that the cross-reactivity and the detrimental effects to patients are kept at a very low and minimal level.
We're at the age now, we have this program on television, but we also have other areas where people can go. The internet, the World Wide Web is full with all sorts of suggestions. And suggestions that are not being accepted by the World Health Organization or even the Ministry of Health here in Ghana, and so that lure people into the mode of self-treatment. And we've got issues of herbs and medication and so forth. Herbal medication and so forth. Tell us a bit about positive and negative usage of the self-medication, and especially using herbs and so forth.
Well, I don't feel well informed enough to speak about herbs and home remedy. Just to say that, we've all grown up in a country that we're accustomed to using home remedies. I can't say anything bad about ginger, garlic, turmeric,
beet.
I don't have enough evidence to say that these things are bad for you. But, having been trained in Western medicine, I can say what I know, and I have no problem saying what I don't know.
But then you see people also take those other chemicals, so calcium blockers, they take stuff, potassium, because and these things. And so they might take their medication, plus they might go and take a supplement that will contain potassium. Tell us about the harm.
So some of these herbal or home-based remedies
or supplements,
unfortunately, what they are the ones that generally can have cross-reactivity with pharmaceuticals. And in particular, something comes to mind with blood thinners. If you use
I was about to make that point, and it slipped to me, that some readings indicated that one reason for high blood pressure is the thickening of blood.
Well, not quite. It's not the thickness of the blood, it's more the tone of the blood vessel. But for patients who are on blood thinners, for whatever reason, they have a clot, they have a blockage, etc., Some home remedy or herbal medication can either increase the effects, so make the blood too thin, and then patients are at increased risk of bleeding, or they can decrease the effect of the prescribed pharmaceutical so that it doesn't achieve its intended effect. It doesn't thin the blood enough. So those are some of the things that you would want to, if you're going to do research and self-taught internet searches or discuss with your healthcare professionals, those are useful discussions to have, to know that these things can interact with each other. The pharmaceuticals, they have to go through an intense and rigorous process before they are released for human consumption. Not so much the non-pharmaceutical or the herbal or the homemade remedies.
A person looking right now will say, well, how do I know that I have high blood pressure?
Yeah, it's a very simple thing to do. Just get it checked. Any pharmacy.
So all you hear, oh, I got a pain at the back of my neck.
Yeah.
Something. I mean, those were the older days, right?
Yeah. If you have blood pressure that's affecting the back of your neck, and I can't discount that that's some people's experience. That's their experience. I can't say if it's true or false. You have to assume that they're telling you something that's truthful, because it establishes a trust, and then you could manage that patient appropriately. But it's not a reliable sign for high blood pressure. There's a reason why we call high blood pressure the silent killer. It can just climb, and you don't know until that point when it causes a stroke, a heart attack, kidney failure, or in men particularly, it can cause erectile dysfunction and peripheral vascular disease and all kinds of other stuff. So you don't want to have those long-term effects of hypertension as the first sign of, or the first time you go to check and try to control your blood pressure. Because oftentimes, by the time you get there, you've lost half of the battle.
This is Health Matters here, presentation by the Ministry of Health. Stay with us. We have our final segment coming up.
What does a healthy plate look like? It's made up of whole grains, healthy protein, vegetables, and fruits. Let's start with whole grains. Eat a variety of whole grains like whole wheat bread, whole grain pasta, and brown rice. Avoid those refined grains like white rice and white bread. Healthy protein. Choose fish, poultry, beans, and nuts, limiting red meat, cheese, and avoiding processed meats like bacon. Fruits and vegetables. Eat a variety of fruits and more green and other colored vegetables daily. They provide a variety of nutrients, antioxidants, and fiber, which build the immune system, prevent obesity, and promote healthy, youthful skin. Use more organic seasonings and less salty products like aji cubes and packet or bottled seasonings when preparing meals. And lastly, stay hydrated. Drink at least 8 cups or pints of water daily. Tea and natural fruit juices are great options. Avoid sugary foods and sweetened beverages. Eat well, keep moving. A message from the Ministry of Health Chronic Disease Unit.
Welcome back to our program. Doc, you mentioned some scary issues there. Erectile dysfunction, other health issues that if you have a prolonged high blood pressure, there. What are the other issues related to high blood pressure that can be really scary to the ordinary man?
Yeah. So hypertension, diabetes, high cholesterol, etc. These form part of what we call polyvascular risk factors. Polyvascular, the name is long, but it's very simple meaning. Poly is multiple or more than one, and vascular is blood vessels. And we're talking mainly about the arteries. These are the blood vessels responsible for taking blood from the heart to the organs. So polyvascular means it can affect all blood vessels, the arteries from head to toe. So let's start with the head, for example. It can cause stroke, both types of stroke, the bleeding stroke and the non-bleeding stroke. It can cause clots or plaques to break off from the neck and fly up to the brain and cause stroke. From permanent debilitating stroke to what we call transient ischemic attacks. These are all potential complications of hypertension in the brain. sometimes it can also cause bleeding, rupture a blood vessel in the brain, and then you have a major problem there. So that's the brain. In the heart, it can cause heart attacks, which I deal with on a daily basis. It can cause heart failure, because when the blood vessel tone is so high, or in hypertension, it can cause two things. The heart muscle becomes thickened because it has to pump against resistance, but also the blood flow to the heart muscle itself becomes reduced. And so the thickened muscle now doesn't have enough blood to supply its own demand. So that also becomes a problem. So then the muscle starts failing, and the pump generally starts to fail at that point. So not enough blood is leaving the heart to go to the brain, the lung, all the rest of the body. So that's how it can affect the heart. It can affect the kidneys and the very dreaded complication of needing dialysis, kidney failure. I'm going to the extremes of how it affects. It doesn't just start off there, but it gives you...
It builds up over a period of time.
Yeah, there's a progression of the disease.
So that's why it's
process.
important to be in a clinic.
It's very important to have screening from an early age, identify persons who have these potentially chronic, debilitating risk factors, and then manage them with early intervention. So we reduce the early age of onset of these complications, and also from a national point of view, it reduces the burden on your healthcare system. We have had credible research in Guyana that shows that the same disease patterns that exist in North America and the developed world also exist here: the kidney failure, the heart attack, the stroke, etc. But it happens here 10 to 15 years younger. So whereas it happens in the 60s and 70s age group in those countries, it's happening in the 45s and the 50s age group in Guyana. And that's because of a lack of proper primary care interventions for our population. But we're getting there with initiatives such as the HEARTS program.
As you put a wrap on the program, just go back and tell us about the system in place with the Ministry of Health to treat and to diagnose people with hypertension and to treat.
Yeah. So the Chronic Disease Secretariat, through the Ministry of Health, is developing a very robust program that includes protocols of identifying patients, screening them, treating them, and trying to standardize the care across the spectrum, whether it's public or private. But most importantly, they are looking at making the interventions, in this case medicines, available on a continuous, reliable basis to all patients in the country. And we can continue to go after our lifestyle changes, etc. But there are a number of persons who would have passed that stage, or for whom that will not be sufficient for them to control their hypertension. So drug intervention, medical therapy intervention is going to be critical for those patients. And one of the barriers to control is availability. So I know for sure that the ministry is working tremendously hard to get that barrier broken and make appropriate care available to all persons requiring care.
Dr. Carpen, thanks a lot for being on our program. Today, we'll be talking to Dr. Mahendra Carpen, Head of Medical Services and Cardiology of the GPHC. Very interesting topic, hypertension. So please bear in mind. I'm Nazim Hussain. Thank you for being on our program or watching our program. Do join us again next time on Health Matters. And until that time, stay safe.
Yeah.